is an artificial root gently placed in your bone where your old root once was. Unfortunately, you were born without one of your bicuspids, and your baby tooth now has fallen out, and it's time for an implant. An implant will replace that perfectly. Why? Because it does not touch the teeth on either side. A bridge is a great option, but I have to tell you, Sarah, we take a tooth that's about this big, and we gently prepare it down to be about that big, and then the bridge goes on the tooth in front and behind the space. Well, that's been a great option for many years. We now have a better option called an implant. The body's an amazing thing. It thinks the titanium implant is actually the original root, and the bone grows into those little grooves that are on the implant. Now, once the body has fully integrated into the implant, we can then put a beautiful crown on top of the artificial root, replacing what you were born without. Now, I have to tell you something. People are surprised how long it takes to get an implant. It can take as long as 9 months to get an implant from start to finish. People say, but Dr. Lordo, my dad, my aunt had a knee and they were walking the next day. Well, remember, your knee is a very sterile area and it heals kind of quickly compared to our mouth, which has a lot of different bacteria in it. So because of the stresses that we put on our teeth and because of the amount of bacteria in there, it can take anywhere from 3, 6, or even 9 months to get your implant. While you're waiting, we have some different options to replace the missing tooth so you never go without your smile. I have to tell you, studies are showing that in 20 years, sometimes as high as 97% of those implants are still there, and they're doing well. I don't know if we can say that about all of our bridges. So I think an implant is a great way to go. If the idea of an implant is too, aggressive, and you're thinking surgery is not the way to go, there's always the option of a bridge, a partial, or even maybe doing nothing and leaving the space there. But by leaving a space, your teeth may shift, which may cause problems in the future. That was a great question.